Hi, everyone, and welcome to the 37th episode of Battles and Voices. I'm Lathika, and I'm the founder and host. Battles and Voices brings together different experiences from people involved in the medical field in order to foster a supportive community for the future generation of healthcare. Please welcome our guest, Kayla. Kayla, thank you so much for being a part of this episode. It means a lot to us that you'll be one of our guests today on Battles and Voices. Feel free to introduce yourself and share some things about who you are.
Yeah, hi everyone. Thank you so much for having me. I'm so excited to be here today to kind of introduce myself and talk about my journey to medicine. So I'm Kayla. I'm a second year medical student and a former Division One athlete. I'm really passionate about lifestyle medicine as a way to shift healthcare from reactive treatment to proactive patient empowered care. So I'm excited to talk about that further.
Amazing. So you mentioned that you were a Division One athlete. So how did that experience shape the way that you think about medicine and healthcare now?
Going into college, I knew I wanted to pursue medicine. I wanted to go to medical school. I was a biology major. I was on the pre-health track, pre-med track. But it wasn't really until my junior year of college, I'd say, that I really got interested in lifestyle medicine. As athletes, we're constantly talked to about how to take care of our bodies to improve performance, things like nutrition, sleep, exercise. We have dietitians on staff. We had strength training coaches on staff who emphasize the importance of strength training. We had trainers who did various forms of like massage therapy, acupuncture. We had behavioral health specialists on staff. And so all of these things are, given to us, these resources are given to us to improve our performance on the court. And I just kind of wondered, like, why don't we emphasize this to everybody? Why is this something that's only given to like a very small percentage of the population? And it was then that I kind of really began discovering what lifestyle medicine was. I learned about the prevalence of chronic disease and how lifestyle medicine can be used to treat and prevent that. It's kind of transformed from then on. It really transformed the way that I want to practice medicine and what I'm interested in. And I'm really excited to be able to incorporate that into my future care as a physician.
That's wonderful, and that's an amazing story to hear about. So, our next question is, how do you apply lifestyle medicine principles in your own life while also managing the demands of medical school?
Yeah, it was definitely very tough at first. Medical school is very different from anything that I have ever experienced with even college. Like it was just like a totally different beast. And so it definitely took like a little bit of learning. But now being almost done with my second year, I can say that I've grasped it a lot better and I have a much better grasp on it. And really the big thing is focusing on consistency over perfection. So it's like, what can I do consistently? There's so many things that I'd like to be able to do, but what can I do every single day and make a habit of? And so I focus on non-negotiables, things like sleep. Like I really try to emphasize getting 7 to 8 hours of sleep a night. I focus on whole food eating. Healthy, nutritious foods that are going to fuel me throughout the day, limiting sugar. One of the things that's really important to me is getting a workout in early in the morning. So I'm a morning person. I get up, one of the first things I do is I go work out because I know that's something that will drastically affect my day. And so those are just like things that I know that I need for myself. And I like to think of, like I like to think of lifestyle medicine just like I would of studying. So like I have to devote 9 hours a day to studying. The rest of my day I can devote to lifestyle medicine because it's equally as important to me. And I just kind of remind myself, like, if I can't practice as a student, then I won't be able to teach it authentically as a physician. So that's something that kind of keeps me going every single day.
Right. I really love how you shape that at the end. So you've also mentioned earlier that you researched on pediatric asthma disparities. So could you tell us what you learned from that and a little bit more about what you do and kind of what you learned from it?
Yeah. So I started it this past summer, this research. It was kind of through my school, and I've been working with someone through my school. And the research has been really cool. We did a literature review of these pediatric asthma like coalitions or collaborations. And essentially these are I guess you could like word it as like projects that have been implemented to try and bridge this gap in in healthcare. And when you think about a pediatric patient with asthma, usually they get diagnosed from their doctor. They maybe see their doctor one, maybe two times a year, maybe more if they have like frequent flare-ups, but really the majority of their time is obviously not spent at the doctor's office. It's spent in places like school or home. And unfortunately, maybe the teachers at school don't have a good grasp on how to care for a child with asthma, and maybe not specific, a specific child. Every child and every patient is different. And so that's where a lot of these children kind of fall off with their care is when they're not at the doctor and they're at school and they have flare-ups, there's a lot of miscommunication on how to take care of them. And same thing goes when they go home, right? Whether their parents are busy with work or, cooking dinner or whatever it is, maybe they don't have, proper education on asthma either. Like they're not able to adequately take care of their children that have asthma. And so it's really just like, how do we make this transition from doctor, school, home more fluid to make sure that in every aspect of a child's life they're taken care of? And so the collaborations that have been done, we've been looking at what makes them successful, and the main theme really is it just reinforces how environment, access to care, and education just really drives outcomes. There's not a lot of research in this area, so I think it's something that definitely needs to be explored further. But in the context of lifestyle medicine and just medicine in general, like in order to be able to truly take care of someone, social context is really important. It's not just about biology, but how can we, like, what does somebody have access to? What are their resources? Where do they live? Those things really shape outcomes.
I really love that. And yeah, I've never heard about research being done in pediatric asthma disparities, so that was really cool to hear about that. Thank you so much.
Yeah.
So, what gaps do you see right now in traditional medical education when it comes to whole person care and prevention?
Yeah. So I'll start off by saying that I am so grateful for my medical education. I even like being able to sit here today. It's amazing like how much I have learned over a year and a half in medical school. I truly feel like medical school does a great job, and medical education does a great job at teaching us about the human body, the different processes that go on in different systems of the body. We are taught about, different presentations and diagnoses, along with the treatments corresponding to each diagnosis. And I truly feel like I've learned so much in that area. One of the areas that that medical education struggles is with lifestyle medicine. We don't get a lot of training in nutrition counseling. I think I've had one class maybe about, and it was one lecture on nutrition counseling. We don't learn about how to use lifestyle medicine as a form of treatment. So, we're not taught about how stress, sleep, physical activity plays a role in treatment and in prevention of disease. So, really, like what lifestyle medicine is, like we don't learn a lot about that in medical school. And it's been tough. It's definitely been hard because, as someone who's really interested in that, it's like I just want to learn more about it, and not having that from my education, it has been really hard. But I have to remind myself that like I'm learning the things that I need to learn, and at the same time I can do my own work to learn about lifestyle medicine in addition to what I'm being taught, and what I'm being taught is absolutely necessary. But I think that's where lifestyle medicine can kind of fill the gap of teaching partnership, prevention, in personalization with patients. Even when we are taught how to interview patients, we're taught to ask the questions of like, what does your diet look like, or what does your exercise look like? But as soon as we get an answer, we're kind of taught to just like move on. So you could ask like, what does your exercise look like? And your patient might say, I walk sometimes. And then, our response is like, okay, great. Next question. Like, what is this? And so we're not really taught how to like dive deeper into those topics. And so that's really where I think lifestyle medicine could play a role.
Right, I definitely agree. Whenever I go to my pediatrician, sorry, they're like always asking about like different things, like I don't know, just like different things. But like
Yeah,
I really like do agree they don't dive deeper, and I
right.
think that's something that they should do, like future physicians like you. And I love that you're kind of pushing for that shift and change in medicine. So, as a medical student preparing for board exams, how do you practice the lifestyle principles that you teach, especially in those stressful and kind of challenging times?
Yeah. So I think the main key that I remind myself is like stress is inevitable, but burnout is not, right? So it's like I'll be, there's times, I'm stressed every day. We as humans just experience stress, but it's how do I limit that stress to be like a good thing in my life versus something that is, really harmful to me and that could, lead to negative effects. And so really stressful seasons are where lifestyle medicine matters most. It's really easy or easier to implement lifestyle medicine when things are great, maybe we're on summer vacation, like you don't have a lot of things going on. But when you do have really busy schedules, that's when it's more important, it's almost more important to be able to take care of yourself through those times. And again, I think just focusing on big picture things that I can achieve every day that aren't going to feel like overbearing or like unachievable for me. So eating healthy meals, like that's something I can do. I go grocery shopping on Sundays usually, and I meal prep for the week when I have like my groceries for the week. So I don't have to worry about going to the store multiple times a week or cooking because everything's usually meal prepped. Or sleep, making sure I get 7 to 8 hours of sleep. And really the big thing that I've learned in medical school and especially studying for boards is to give myself like a time frame of studying, of when I'm going to be able to study and being able to like cut off when I'm done. So really my schedule looks like from 8 to 5 is usually like my study time frame. So before 8 a.m., I'm usually, I work out, I'm kind of getting ready for the day, I'm taking some time to myself. And then at 5, like I'm usually done. Sometimes here and there I'll do like some light like flashcard studying type thing like after 5, but the main bulk of my studying is like done at 5. And it just helps me too to know that like that's the time I'm going to be productive, and then outside of that time block, like that's my time to be able to do things that I enjoy, talk to loved ones, hang out with friends, be able to like do the lifestyle things that I love so much. And so that's really been important. And I think just the big thing is like lifestyle medicine isn't about adding more, it's about just like being able to support yourself when life is demanding.
I really love that answer. And yeah, the schedule that you mentioned from 8 to 5, that sounds really realistic and really easy to kind of catch on every week. And I definitely do have to agree, especially doing stressful seasons, it's easy to kind of like burn yourself out and kind of like challenge yourself and all that. And it's important to take a pause and, do things
Yeah,
that you love. And yeah. I really love
yeah,
that answer.
yeah.
So, lifestyle medicine can sometimes feel overwhelming to people. So, how do you make those concepts feel achievable and realistic for everyday people?
Yeah, definitely. That is, I think, one of the biggest criticisms that I hear is that oh, there's so much. There's never like I'm always seeing new things on, especially like social media. That's a big part of it too. Like seeing all these things that like different influencers and different people are doing. And so I definitely can see how it would feel overwhelming. But one thing that I'll say is like I think that's actually part of the beauty in lifestyle medicine is that it's not one size fits all. And there are so many different options for people depending on what you need. So something that works for someone, it might not work for you, and maybe something else works for you, right? You can go pivot, you can try something else. And there are so many different shapes and sizes. And I think that's where it kind of differs from like traditional medicine, where it's like, this disease or this illness has this one specific treatment that goes with it. In lifestyle medicine, it's like, hey, we can do XYZ, so many different things to help with your diabetes or with your high blood pressure, your hypertension. So that's part of the overwhelming, aspect is because there's so many options. And I think that's pretty amazing. But yes, it definitely can feel overwhelming. And so one of the things that I like to talk about is meeting people where they are. And we talk about this actually in medical school is, it's like partnering with your patient. So if somebody comes in and they have no idea what lifestyle medicine is, maybe they live a pretty sedentary lifestyle, they adhere to a standard American diet, they don't get great sleep, they're really stressed out. Those are, the major red flags of like lifestyle areas that need to be fixed, right? But if we try to fix all of those things at once, it's not going to turn out very well, and it's very likely that that person will become overwhelmed and not want to do any of it. So it's like, what is one small thing that we can do today? What's one small change that you can make to improve your life? It might not fix everything, but we can get on that track of improvement. So maybe it's okay, there's all these areas. Let's focus on 30 minutes of movement a day, right? Whether it's a walk, whether it's strength training, whether it's a bike ride, whatever it is, let's do 30 minutes of movement. And let's do that for a couple weeks. And I'll come back and see me in a few weeks and we'll see how it's going. We'll check in. And maybe if you're feeling good, you made that into a habit, we can add something. Maybe we focus on your diet next. So I think the big thing is like emphasizing progress over perfection and reframing lifestyle medicine as like daily habits instead of like drastic overhauls of things that you need to do. Because at the end of the day, consistency will beat intensity every single time.
I love that approach. I think it makes lifestyle medicine feel way less more intimidating, and I think it makes it feel like more doable at the same time.
Right.
So, I know you spoke about this in the previous question about social media, and of course, it can have a really big impact on people. So, what role do you think that social media should free in healthcare education, and what responsibility comes with having that platform?
Yeah, social media, I think, has been great in the way that it increases access, right? Like for people to have access to education and things that maybe you wouldn't normally have. It can normalize. It has normalized things like prevention, lifestyle medicine in general. I feel like, especially on social media, like health and wellness has been like a big topic as of lately. And it also really empowers patients with knowledge. So I think those are like some really great things. But yeah, like you said, like with that comes the importance of accuracy. It's like, who are you listening to? Who's giving you what information? There's lots of conflicting views. And we want to avoid fear-based or like absolutist messaging of like, you have to do this or this is going to happen. Like that can be pretty dangerous too. Because education really should be about empowerment, not overwhelming. So, I want, as a future physician, like I want to encourage my patients to like do their own research. I want them to be able to come to me and be like, "Hey, Dr. Martin, like I saw this on social media. I don't know what your thoughts are. Like, what are your thoughts on this?" And I want to be able to like encourage that open dialogue. Because I think right now, a lot of a lot of medicine and a lot of like doctors don't necessarily like that. Like they don't encourage this idea of like patients coming to them with different things that they've seen, because it's like, oh, it's just this a long conversation that I have to do to like debunk this or whatever it is. But really, like I want to have those conversations of like, yeah, I don't necessarily agree with this because of this. Because at the end of the day, like your patients are the ones that are making decisions. And like I want my patients to be extremely well informed with the decisions that they're making, and to have all their options laid out in front of them. So social media, I think, to kind of sum it up, like it's a really great tool for having access and for empowering patients with knowledge, but it shouldn't necessarily replace the doctor patient relationship. I think it should be like a conversation starter, but the doctor patient relationship is ultimately what's most important.
I really love how you explained that. And I think nowadays, social media, of course, as you said, is a great tool, but oftentimes it can be misleading to patients. And usually people trust whatever they see on online, more than they trust their doctors.
Right.
And I personally do that as well. Like whenever I have something like, let's say like a type of rash, I just go up on Google and search up,
Yeah. Yeah.
hey, what's the type of rash? And then Google tells me, oh my gosh, I'm dying in like 2 minutes.
Right. Yeah.
But yeah, people do kind of, trust more on like social media and websites, Google, all that, than, doctors and nurses. So I think it's really important what you're highlighting.
Yeah, thank you.
So looking ahead, how does your ideal future clinical practice look like in terms of care delivery and patient relationships?
Yeah, well, I definitely ideally would like to have my own practice at some point, like an outpatient clinic. I don't really see myself like in a hospital setting necessarily. I want to be able to, yeah, like have my own clinic, establish relationships with patients. That's something that's really important to me is again, the doctor-patient relationship and being able to follow my patients over, the trajectory of their life and see them improve in their health. And I really ultimately want to build a practice built on partnerships. So, like, I want to ideally have like multiple healthcare professionals in my office, dietitians and nutritionists. I'd like to have physical therapists. I'd love to have like behavioral health professionals, kind of like because I think one of the problems in medicine right now is that it's so siloed. Like there's this idea of like siloing of medicine where you go see one doctor, they go refer you to a specialist who then refers you to somebody else. And in that, like so many things are lost. Like so many things get lost in translation. So it's like, how can we minimize that? And how can we have like an area or a place where it's almost like a one-stop shop? And like you don't have to be referred out, like everything's within that practice to where it's easy to keep track of each person and be able to like really affect their health. I want to make sure that my practice, and these are kind of like big picture things, but like right now there's a lot of, especially with like insurance and things like that, having to see patients within 15 minutes, right? Like doctors are like book, book, book. But I would love to get to the point where I could really just like take time to listen, educate my patients, really like do these things, these lifestyle medicine things where I am able to like incorporate that into their care. And I just ultimately want to make sure that like my patients leave appointments feeling like hopeful and equipped rather than like dependent on me. Like I ultimately like I'm a tool for their health and I want that to be like kind of the frame of my practice. So I think by formatting it to where I have multiple healthcare professionals and like really leaning into the whole lifestyle medicine thing and taking time with each patient, I think that will ultimately serve me and my practice and my future patients.
That's wonderful. And that really sounds like the kind of care that people do remember.
Right.
But yeah, I definitely do have to agree about doctors referring to other doctors because it's
Yeah.
happened to me and my family a lot of times.
Yeah.
Like one time I went into the orthodontist, of course, I have braces on. So I went in, it was like a normal checkup, and then after that, they just like my orthodontist just told me, hey, you have to go like extract these four teeth so your teeth have more space to kind of like form and like reshape. And I was like, okay, cool. Can y'all do that like,
Yeah.
in a couple of weeks? And
Right.
then he was like, sadly, no, we do have to refer you to an outside doctor.
Mhm.
And I think that doctor lived like 2 hours away from me.
Yeah.
And, of course, outpatient and other doctors, it takes a lot of time to book appointments
Mhm.
and they're really overbooked. So I think it took me like 2 months to even get an
Yeah.
appointment.
That's crazy.
So
Yeah.
yeah, I think that's something that is really needed in a practice, having certain professionals and doctors like be able to collaborate and come together and be able to treat that patient at one time instead of the
Yeah.
patient having to go like so many different ways
Yeah,
just to get
absolutely.
treated.
And that
Yeah.
just really, like we were talking about gaps in healthcare, like it really honestly just widens that gap, especially for patients who
Hmm.
can't afford multiple doctor's office appointments. Or like you said, like if you're waiting months to get scheduled for a different doctor, like it's just so much harder to be able to take care of yourself when like that's the
Right.
situation.
Right. So, you may have many people who have inspired you to get into medical school, but is there anyone in particular that has inspired you to reach the stage where you are today?
Yeah, I think, my family is a huge part of where I am today. I am so fortunate to have people in my life that like really fully support me and all that I do. Like my family has been there through every single like trial and tribulation. Like in a way, they are like living this journey like alongside with me, and like they just continue to encourage me like every step of the way, and I like honestly would not be here without them. So I would definitely, say my family first and foremost and my loved ones. But I also have to like, I think about all the physicians that have advocated for lifestyle medicine that have gone before me, like Dr. Casey Means, Dr. Mark Hyman. Those are just a couple names of, physicians that have kind of like paved this way for lifestyle medicine, holistic medicine to kind of be like more of a topic that people discuss. And without them and their expertise too, like I would be extremely lost. And so it's nice to have like physicians that have done this and that I can kind of look up to as like that's where I'd like to be someday. And yeah, so I'm just really grateful to kind of have those people as mentors in my life.
That's so amazing to hear. And lastly, to wrap things up, do you have any advice to give to any of the members in the audience that might be listening right now, hoping to enter the same line of work that you're in?
Yeah, I would say like never lose track of your why. Things get really tough, especially in the medical field. It's a long, long journey. But if you can wake up every day and remember why you're doing what you're doing, it makes it so much more manageable, and it really, really, truly like empowers you. I remember hearing that, like I heard it as an athlete all the time of like, remember your why. And I'm like, now in medical school, it's like, remember your why. And I used to honestly like hate that question of like when people be like, why are you doing this, why are you doing this? I'm like, I don't know how to like describe it, and there's so many ways I could answer this question, but like all that really matters is deep down why you're doing what you're doing. So never lose track of that. Stay curious, like always just have that curious mind of like wanting to learn, because it truly makes learning so much more interesting. And always remember to protect your own health. You can't take care of people if you don't take care of yourself. So make sure you do the things that are important to you, incorporate lifestyle medicine into your life. And the best physicians ultimately are credible because they live what they teach. And I think if you just remember that each day, it really helps you stay on track and be the best physician or healthcare provider, whatever path you're on for your future patients.
I really love that advice, Kayla. Thank you so much again for sharing your experiences as a medical student and the steps that you've taken to reach this particular stage in life. It was truly inspiring to hear about the path that you took and the passion that you have for healthcare without gaps. To everyone tuning in, thank you so much for joining us on this episode of Battles and Voices. Your engagement and loyalty means the world to us. If you enjoyed this conversation, then be sure to follow, share, and stay tuned for more episodes on Battles and Voices. We'll see you next time.